get started with today's episode, I would like to quickly read you our podcast disclaimer. This podcast is for educational purposes only, and it is not to substitute for professional care by a doctor or other qualified medical professional. You should always speak with your physician or other healthcare professionals before doing any fasting, changing your diet in any way, taking or adjusting any medications or supplements, or adopting any treatment plan for a health problem. The use of any other products or services purchased by you as a result of this podcast does not create a healthcare provider-patient relationship between you and any of the experts affiliated with this podcast. Any information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease. All right, and now we'll get started with today's episode.
Welcome to the Fasting Method Podcast. This is Coach Terri Lance, and I'm very excited to be here this week because I am here with Coach Bethany. Bethany, how are you doing?
I'm doing great, Terri. How are you?
I'm doing great as well. It's been a long time since we've been on here together, so I'm very excited to have this opportunity. So Bethany, I thought maybe we could just kind of share a little bit about the topic and then launch on in. As some people are already familiar with you from other episodes and from the TFM community, you not only have great knowledge about fasting and eating well and resolving health concerns by doing so, but you also are a certified personal trainer. And I think you bring something very unique to us here. So I wondered if we could talk today about something that I see a lot in our community, and I imagine with our listeners, is that people often have certain beliefs about movement and exercise and might be doing themselves a disservice on one of two ends of the continuum. They might be overdoing it with exercise, or they might be underdoing it with exercise. So I wondered if maybe we could start by talking a little bit about some of your knowledge and what you see happening. I don't know if you might want to call it overtraining or not recovering or whatever, but maybe we could start with that end of the continuum.
Sure. So overtraining is possible for everyone. I just want to underscore that right off the bat. It is not reserved for professional or collegiate or competitive athletes. It is absolutely possible to overtrain if you are a working professional with a family. And that threshold for overtraining is going to be different for everyone, and it changes over time. So as you become more fit, you're able to produce more and move more without hitting that threshold. I want to go into some signs of overtraining. And as I talk about this, it's really handy that our audience has a working knowledge of fasting because there are so many points of useful comparison. So just as we talk about signs to break your fast that are actual signs of danger for the body, the top one probably being nausea, others being malaise, body aches, brain fog. Those are all signs that you might be entering a dangerous place physiologically. That's very different from experiencing a wave of hunger when you're fasting, or experiencing a wave of boredom or overwhelm that makes you want to eat. And similarly, signs of overtraining are different from just feeling a general kind of lack of motivation or not wanting to go to the gym or not wanting to stick to your workout program. So signs of overtraining are, first and foremost, profound fatigue, poor quality sleep in spite of feeling really tired. You'll also experience delayed recovery for the same output. So for example, if you're used to running 3 miles 3 times a week, and suddenly, you've added, let's say, a strength training day in, and suddenly every time you run 3 miles, you just feel like absolute garbage the next day and for several days. That could be a sign of overtraining, just to, mention an example. The other example is unusual soreness. So again, from the same output, if you are changing your workout program or if you are increasing the intensity or the volume, we would expect soreness from that. But unusual soreness from the same movements can be another sign of overtraining. I will tell you, I have experienced overtraining at several different points in my life. It has felt slightly different each time, but the one sign that was persistent through each of these is that my whole body felt bruised. It really felt like I had kind of been dropped out of a second story window. And that's without, any impact actually being put upon my body. That's how it feels, just a real full body soreness. For menstruating females, you might experience menstrual irregularities or lose your period. With fasting and starting a new exercise program, there's often changes to the menstrual cycle, but that's usually, not every time, but usually you still kind of stay within the realm of the average, maybe 24 to 35 days. If you start completely missing your period, that can be a sign of overtraining. Other signs are compromised immunity. So you might feel like you're catching every cold that goes around your office, or that every cold you get sticks around for 3 weeks. And lastly, you might have mood problems develop where you didn't before, and you'll start to face, this is a really common one, although it manifests differently for everyone, a real mental block in the gym. I can remember one of the times that I experienced overtraining. I walked into the gym and I actually said out loud to my trainer, I feel like I cannot even look at a squat rack right now. I mean, it is just so profound. So those are some of the signs of overtraining.
I really like that you shared those, Bethany, because I think for someone like me who's doesn't have a lifelong pattern of exercise or working out, I might misread things. And for sure, I might misread, ouch, my legs hurt when I walk, or every time I try to sit down, it hurts. But that's different than what you're talking about from overtraining. That's more likely happening because my body's not yet used to that type of movement. And I'm going to feel some soreness, but not the type that you're talking about with overtraining.
It is admittedly quite hard to describe the difference. But as I mentioned, having felt this several times in my life, it is profoundly different. It is qualitatively a different feeling than just muscle soreness. And it goes on for longer than muscle soreness. And it's also more systemic. Like I mentioned, so many things that were thrown off in life because of this. Your mood, your motivation, how you feel, your hormones, your sleep. Whereas when you only have muscle soreness, yeah, you might think about it when you're walking down the stairs or when you're sitting down at your desk, but it's not really impacting your entire life.
That's a great distinction. So if this is something that someone's kind of questioning, I wonder if I'm overtraining. What are some thoughts that you have about what could they do to help resolve this?
So first and foremost, I would recommend not discontinuing exercise altogether. So Terri, you have, I think, one of the most quoted metaphors of all time from this podcast, the fasting dial. And you liken it to an old TV that has a dial instead of a remote. And similarly, if you're experiencing signs of overtraining, I do not recommend that you just lay up on the couch. I would recommend that you start scaling back on your workouts. So this could mean several things. You could scale back the frequency. Instead of doing 3 days, do 2 days for a certain amount of time until you feel like your feet are back underneath you. Or you could continue to go for the same frequency and dial back either the volume or the intensity of what you're doing. At the very least, I would recommend continuing for ambulatory people, continuing walking. Active recovery is one of the best things that you can do for recovery and also body composition. It's also, walking is extremely compatible with a fasting lifestyle, and we're going to talk about that later. But it is generally not something that, when done within a certain level of intensity, that compromises one's ability to fast. Other things really begin to focus on hydration and include electrolytes with that. You might want to think about some sauna. Now, if you are doing a therapeutic length fast, you want to be really careful about sauna use because it's another dehydrating event for the body. So just be mindful about hydration. Another great thing to do would be some Epsom salt baths, and make sure that you're getting adequate protein. Now, what does that mean? It's different for everyone. This was actually discussed on a recent podcast episode. It was a Q&A with Dr. Fung. He addresses this, but you want to focus on getting adequate protein for you on a weekly basis. So please don't stress out about things like meal timing or protein timing, etc. Generally, for people who are doing therapeutic fasting, those are not the same people who are trying to optimize athletic performance. And so precise meal or macro timing is just really an unnecessary optimization. The last thing is that, and this is a big one, people who have a difficult time scaling back on their exercise, it's often because they have an association with exercise that it does something good for their emotions, which is absolutely true. But it can't be the only tool in your toolbox because, as I said, everyone can enter sort of a state of being overtrained. So having a mindfulness activity that works for you is really important and can help the body come back from this state of being overtrained even faster. I'm a huge fan of journaling right now, but people love guided meditations, silent meditation. You can do a walking meditation. All of these things can be kind of combined to help you get out of this state.
I think that's really important, like you said, Bethany, that oftentimes when we, in this example, overtrain, so doing too much focus on the training part, it's often because it's associated with something. And like you said, for many people, it's associated with this helps with my mood or this helps manage my anxiety. I also think a lot of people over stress their body or push too far with exercise because they've associated it with the old, this is the only way I will lose weight. And so if 20 minutes of exercise is good, 40 must be better. And if 3 times a week is good, 12 times a week, 3 workouts a day, and think that that would be even better. And I've heard that from some community members recently that they're so invested in all of the benefits of working out or exercising, but they don't recognize that they might be just kind of lobbing onto something that's really good for you, but going to a degree that is no longer good for you.
I completely agree. I think that people are really fearful to scale back at times for that reason. As you mentioned, Terri, exercise is a stress, and it can be a good stressor on the body, and that's how we grow. But I mentioned at the beginning that everyone can be susceptible to overtraining. And if you have a lot of stress in your life, if you are an executive or really have any kind of stressful job, if you're responsible for caretaking, if you are a parent, really, of children of any age, all of that, it comes out of the same bucket. We don't get a separate gym energy bucket. So if you just keep piling onto that, it can actually be counterproductive. And I think that's what people don't see. It's similar to not doing an extended fast every single week. I don't think that there is a coach at TFM who recommends something like a 5-day fast every single week for the entire journey of the therapeutic fasts that people are doing. You put them in once a month or once a quarter. Similarly, you wouldn't recommend, if someone was trying to move toward fat loss or reverse their type 2 diabetes, time restricted eating probably would not be sufficient. So you really want to find that sweet spot, that middle ground where you're moving towards your goals and not setting yourself back. Also, I have to mention this when it comes to fitness, there is so much information and misinformation available on the internet. And we, in the past 10, 15 years have seen the rise of fitness influencers. That wasn't, it was a job before, but a very, very few people in the world had it. And now they are everywhere. And what I want to say about that is you have no idea what's going on behind the scenes. So people often have their favorite fitness influencers and think, oh, I would love to have their body or their body part, or even, you don't know what that person is really eating. You don't know what they're doing for recovery. You don't know what they're taking supplement wise, peptide wise, etc. And more than that, if you're a fitness influencer, that is your life. I really can't stress how much focus and attention and in some cases, unhealthy obsession is required in order to do that. So it's really not something that is desirable or attainable for most of us.
That's really helpful. And as you were talking about the parallel with fasting, just like for therapeutic goals, we wouldn't recommend someone only do TRE long term. Can we talk a little bit about the flip side of this? Not overtraining, but maybe undertraining. And I think, I talk a lot about mindset and behaviors. So I often hear people who are a little maybe hesitant to do exercise. They might have a history that kind of tells them they don't like exercising. They've had experiences in the past that tell them that it's challenging for them and that they might not be able to do it. And then I hear some people almost describe it as a limiting belief that if I only do a 20-minute walk, Bethany, that's clearly not going to help me. So why bother? I'm more comfortable staying on the couch. So I kind of hear this as two opposite ends of the spectrum, people overdoing it, thinking that this is the way to get the results they want. And then I hear people underdoing it because they're not really convinced that some will even matter.
That's a really great question. And there's excellent news I have for those people. The minimum effective dose, if you are inactive, is going to be very little movement. So getting out and walking for 20 minutes a day is going to be stepwise a huge advantage for you in terms of longevity and decreasing all-cause mortality, improving your blood sugar. So it is not the case at all that, oh, well, it's just 20 minutes, which is nothing, so I might as well do nothing. As I said before, walking is one of my favorite things to recommend, not just for people who are fasting, but in general. Zone 2 cardio, I don't think there's ever been a time that it's been discussed more than in the last few years. It really makes a huge difference in terms of your levels of fitness and your body composition and also your mental well-being. I wonder, Terri, if people have been, a bit scarred by previous experience of going too hard with exercise while also being on something like a calorie restricted diet.
Mm-hmm.
And if they just associate it with pain and feeling undernourished and unwell, this is a totally different approach. We're talking about slowly ramping up your movement. In a former podcast, I talk about fasting and exercise. It's episode number 155. And I talk a lot in that episode about specific exercise types that are compatible with fasting, namely Zone 2 cardio, which in layman's terms is cardio that you can do while still having a conversation. Now, you won't be able to speak as easily as I am right now to Terri because I'm not moving, but you should be able to have a conversation without really sacrificing many words. That and strength training. And I talk a lot in that episode about the difference between strength training and training for hypertrophy or muscle size growth. The two are different. But again, if you are inactive right now, please don't discount getting a 15-minute walk even. Not to mention, there's been tons of studies that show that walking for 15 minutes after a meal reduces your blood sugar. It blunts the postprandial blood sugar spike, which for people in our community is a huge help for most of their goals. If you do that and you even do body weight movements, body weight squats, do 10 as you're getting up from your desk every day, start there. Maybe don't take it to that uncomfortable level. Don't let yourself take it to that uncomfortable level and just start moving in a way that feels good.
Yeah, I love that your reference to the idea that for some of us that may be from past overdoing in a certain way and experiencing it negatively, like undernourishment, reduced calorie, low fat diets that many people did or have learned to do, and then excessive cardio, not zone 2, and they're miserable, they're hungry, they get hungrier from doing this. And so they see it as really not paying off and kind of pointless to do. And I'd have to agree with them. It's not the route to take. And I love that you have such a more balanced approach of starting small, building, doing it for health benefits, mental health benefits, metabolic benefits, all of those things, to really value movement and longevity and, just staying young. And heck, for me, even thinking about a lot of what you've touched on is stuff that we can do outside, weather dependent. So getting out in nature, seeing nature, lots of benefits there too. So I think when I think of people who maybe have gotten burned out by it before, when you were talking about it, Bethany, I pictured people on The Biggest Loser television show.
Oh.
And I hate to admit that I watched pretty much every season of that. This was before I knew a lot of things. And I just watched these people who were being so calorically restricted and so pushed beyond ability and beyond capacity at that point. They would do a hard workout and they would be throwing up and crying. And I think this is how a lot of us think it's supposed to look, that if it's going to benefit me, it will be miserable. It will be terrible and miserable. And I think you just paint a very different picture that that's not at all what it needs to look like or feel like.
It's not. I can remember watching that show as well years ago. I work out very consistently, and there is not a single session where I leave the gym crying. Now, if I'm doing a new movement, I might walk out and think, wow, I'm really going to feel that tomorrow. But I don't feel that my body has just been put through the ringer. And I've made really strong strength gains over the past few years, and so have my clients. I don't take them to that level. And I always say to them, I never want to get you above maybe a 7 out of 10 soreness because there's just no need for that. So yeah, it really is about, I think the theme here is really finding that sweet spot where you are not pushing so far beyond your, as you said, your capacity, but you are moving.
Yeah, again, the fasting dial, I think you've now somehow gotten in here too. There's an exercise dial.
Yes.
There's a physical movement, physical activity dial that's really important. And it's not helpful for us to not register anything on that dial. And it's not helpful for us to throw that dial all the way up to the top and keep it there beyond what's good for us.
Absolutely. So for folks who feel that they may not, that exercise might not be worth it because they have decided they are absolutely not going to exercise for hours upon hours each week, they might think, well, I'm not vain. I don't want to chase vanity. And that is absolutely fine. I love that. I heard a story a few years ago from a friend of mine who had worked as a fireman, and he got several calls working as a fireman, and they used to get emergency medical calls. And he once got a call from an elderly woman who had been stuck on her toilet for several days because she was not strong enough to stand up. She eventually sort of rolled off the toilet and crawled to the phone and was able to get help. But she did have to get hospitalized because she was so dehydrated, because she had been there for days. And that's always something that I think about. Not every time I go into the gym, but I think about that story at least monthly, because the natural progression of life is that if you do not interrupt that path, you will get weaker, you will get less powerful, you will get less coordinated. And so that was just such a poignant story for really creating a why around exercise that had nothing to do with looks or vanity.
I love that. And as you were talking about it, Bethany, I was also picturing, people in my family or people close to me in their family, their mom or uncle or dad or whomever, also losing balance. So strength and balance. And what wound up kind of being their downfall was they fell over while just standing in the kitchen,
Yes.
grabbing something. And I know at my age, I still take all of that very much for granted. And I think you sharing that story just reminds me, yes, I have those abilities right now, but as I age, I will lose some of those abilities, and I get to influence how much of them I maintain and how much of them I lose and how quickly possibly. So really kind of a good inspirational little aha moment there for me even. So Bethany, we're going to wrap up here, but I just want to thank you so much. I feel a little naughty that I get to benefit so much from the guests that I have on here, but I thank you so much for your being here today and everything that you shared with us. And maybe even especially for me, that story at the end just really is a really good reminder of why movement is so important for me to make more consistent in my life.
Thank you, Terri.
All right, everyone. Well, there will be another episode next week, so I wish you all well until that time. And once again, thank you, Bethany.